two. Hi guys, welcome back to our Facebook Live tour. We're now here with nuclear medicine, and I'm going to introduce you to some students to show you the program.
Hi guys, so my name is Oksana.
I'm Danielle.
And we're second year nuclear medicine students at the Michigan Institute. So a lot of people ask us, what is nuclear medicine? And I'm going to hand over to Danielle. She's really good at explaining it.
So basically what we do is kind of the opposite of X-ray and CT. So in those modalities, what they're doing, the machine itself is giving the radiation to the patient. We do the opposite of that. So we actually give the patient radiation through an injection. And then our cameras are able to pick up on that radiation, and we're really focused on imaging the function rather than the anatomy in the body.
And we go into more of a molecular level, whereas CT and X-ray are really looking at the anatomy of the patient. Not that we're not. We do have a CT portion that we add to our nuclear medicine scan, just so our scans look more accurate and you can really see where the radiation is going into the body anatomically. But like Danielle mentioned, it's more functional imaging, and yeah, so that's kind of the breakdown of what nuc med is.
Take a look at this.
Yeah.
So this is one of our cameras. This is typically what you would actually see in a hospital now. So this is called Brightview. So these two heads, so this one here and this one here. So those are the gamma cameras, so those are what pick up on the radiation. And then beside it, we actually have a CT component. So that's going to give the CT so that we can see the anatomy better and correct.
Yeah, and then this is our P-scope, where we usually are able to see, there's nothing on there right now because there's no radiation in the patient, but usually here you're able to see the counts and what's being emitted from the patient. So one of our two of greatest scans, we have bone and cardiac, so that's like the bread and butter for nuclear medicine technologists. So we're either usually looking at the heart or the full body, but there's a lot more scans, there's a lot of pathologies that we learn. Yeah. So I guess we're going to take you around the department. Oh yeah, they're just doing a spec acquisition when it's going continuously, sort of.
Because you're literally
You know?
okay.
Okay. So image processing.
So this is an example of one of the images that we might do. So this is a bone scan. So what we've done here is we've given the patient a radiopharmaceutical that tags to the bones, specific molecules in the bones. And we can see if there's any increased or decreased uptake. That's really what we're looking for, and that can give us an idea of if there's any pathologies.
Yeah, and we do a lot of image reconstruction. So we can play around with the images by like changing the contrast or changing the color map. Like if we want to see rainbow, ooh, looks cool. Just so we can get a better idea of where specifically the radiopharmaceutical is going and where there is a problem. That really depends on what the radiologist wants. But yeah, we do a lot of cut and paste as well. Yeah, and if we have to rescan, we can see if there's a lot of patient movement, which is probably the factor that a lot, like we mentioned, it's detecting the functionality. So if the patient's moving a lot, we might not get the best image, so we might have to rescan. And yeah, we can really see that on the images as well. My arm.
So this is an example of one of our fake arms that we practice our injections on. So right now it's set up to take blood. So I'll turn it on.
Yeah.
So we do actually take blood in order to tag it to a radiopharmaceutical, and then we would re-inject it into the patient. So this is something that we might actually do. So we just take this, put it on, and then get some fake blood.
Collecting a vial of blood now.
Yeah. So that's something that we would actually do, and that we do practice in labs.
Yeah, so we do a lot of phlebotomy as well, not just focusing on images. We have to learn how to inject. So this is usually our dose draw section where we're drawing our radiopharmaceuticals that we're going to be injecting into the patient. So yes, these are our little lead cases where we usually carry our injections. Most of our needles are always protected with a syringe shield for lead because we are dealing with radiopharmaceuticals. And yeah, we always are behind some glass or lead for protection as well.
Cardiac. simulation of cardiac. So cardiac is one of the main scans that we do in nuclear medicine. So basically what we're doing here is we're looking at the blood flow to the heart. So we do something called a rest/stress imaging. So we give an injection to a patient, and then we put them under the camera, we take images of their heart, and then after that we're going to put them on a treadmill and we stress their heart. So there we have a treadmill. We have an ECG right beside it, so that we would hook up to the patient as well. And that's so that we can monitor them while they're on the treadmill to make sure there's no abnormalities going on. So once they reach a peak heart rate that we've predetermined, we're going to give another injection, image them again, and then we compare the two and we can see the blood flow, see if there's any lack of blood flow or anything like that.
Yeah, so we learn how to read also a lot of ECG strips for any arrhythmias that may happen during our tests. So we're not ECG techs per se, but we also learn the role of them and how everything works with ECG and how to read any arrhythmias. So this is kind of like our old school. We don't use this anymore, but we thought it was kind of cool. So we also do dynamic imaging. So what we do is we can inject a patient that's right under the camera, and we start that position right away. So we really see the flow of the radiopharmaceutical into an area, for example, the bone. We usually do that. So that kind of looks like a dynamic image where it's just lots of pictures right away, trying to see the flow of it.
And just another example of a bone imaging. So the same that we saw on the screen back there, but this is just on the film here. So we don't use that anymore, but just the old way that they used to use it.
Yeah, and right behind you is some lead aprons for radiation protection. We usually use this when we're in the radiopharmacy, eluting our radiopharmaceuticals with a generator. You are able to wear this on a day-to-day basis if you want some extra protection. But like we mentioned, none of our cameras give off any radiation or any x-rays or anything like that. It's usually the patients, so as long as you're not standing very, very close to them and you keep your distance, you're good.
Just a couple questions for you guys as students. What made you choose to go into nuclear medicine?
So I first heard about Michener from my mom, and then I kind of looked into the programs, and I'm from a biochemistry background, so I really thought it was cool that it goes into more of a molecular level, which is what I was into, and it's very specific, and I also thought nuclear medicine was super cool, so I kind of just went into that for that.
Yeah, I heard about it actually from a professor in my undergrad. I heard about Michener, and then I was researching the programs, and I knew nothing about nuclear medicine at all. I'd never heard of it, never seen any of the cameras, and I was like, you know what, I'm just going to apply. And I applied and got in, and yeah, very happy with that.
Very, very glad that we're here.
Yeah.
Awesome.
And just one last question. Is there anything since you've been in this program that surprised you about the program or Michener or just healthcare in general?
Oh, that's a hard question. I think the most surprising thing in this program versus like university programs is it's a lot more practical. You are doing hands-on things. It wasn't a surprise per se, but I really enjoyed that it was not just testing you on your knowledge, like writing a multiple choice exam, but it's really testing you on the practical hands-on aspect that you're be applying to your day-to-day job.
Yeah, and I think I wasn't really expecting the kind of crossover of learning like about CT and ECGs. So that was surprising to me to learn about that. I think that was.
Yeah, so you learn a little bit more than just being a nuke med tech. You learn the greater scope of everything, which is great.
So that concludes our tour of nuclear medicine. Stay tuned for our next video.